The next step is to help clients develop a fluency in the language of parts so that the unblending process is supported by a change in language. So for many, many sessions, I have to become the simultaneous translator. The client says, I feel, and I say, yes, there's a part of you that feels. And the more intensively the use of the language of parts, the more quickly students learn, just as they do in any language. This was particularly important for Dee because she was really becoming increasingly unable to function because of the heart's activation. And so we had to really work very hard to develop her fluency in parts language. Because as soon as she unblended, as soon as she noticed the part, rather than being blended with the part, her nervous system would begin to calm. The other advantage of using the language of parts is that it increases mindful focus so that the prefrontal cortex becomes more active, and also because mindful activation of this part of the brain, the medial prefrontal cortex, is associated with reduced autonomic dysregulation. So that automatic pushing away of sad feelings, frightened feelings, thereby pushing away the part, really we saw as an instinctive reaction that was part of her survival and adaptation. That as a child, she didn't have the luxury of feeling her feeling. And so this habit of automatically pushing them away was so powerful that her intentions in therapy, which were to do the work, got overwhelmed. And so it was noticing the pattern. It was really mindfulness. We forget mindfulness sounds very, very simple. You might feel, well, I'm not doing anything. But mindfulness has such powerful effects on the brain. We're actually doing a lot without appearing to do a lot. And so it feels simple and easy to the client. So I just would say, notice that pushing away. Well, I'm not pushing away. And I said, notice what happens when the sad part comes up. Do you lean toward her? Do you pull away? Do you tense up? And she said, well, I do tense up. Okay. So notice the tensing up. And notice how you're tensing when she's sad. Notice the effect on the sad part. And she said, oh, yes, the sad part gets sadder. And what happens if you feel the sad part and you relax your body? Is that better or worse? And she said, it's better. So again, these are mindfulness techniques and somatic techniques, right? Notice what happens when that sad part comes up. Even the technique of, do you want to lean in? Do you want to pull away? Do you want to push away? Or do you tense up? Those are mindfulness-based techniques. And they are very, very simple, but also very powerful. Because remember, we can't learn without the prefrontal cortex acquiring information and encoding it so we remember. Any technique which helps to keep the prefrontal cortex working, firing, is a technique that we want to use. Very, very important in trauma. Because without the prefrontal cortex, we can use very, very interesting techniques and interventions. But if the client can't remember what they learned, it is not going to have the effect that we are attempting to have. The emphasis on reframing distressing emotions as parts helps the client to pause, step back, and notice. Dee, despite her very high intelligence and accomplishments, I joked with her once. I said, "You are an instant blender." Okay? A part comes up and instantly you blend with it. And so by slowing things down, translating into the language of parts, it helped her to practice feeling the distress, pausing instead of reacting to it, and to really separate from it and notice it. And so that is a very, very important piece of the work that she and I did session after session after session after session. And very, very importantly also, another important piece of this is the facilitation of curiosity, interest, and empathy for the part. It's not just enough that the individual separate from the parts. It's also necessary for the client to become curious and interested. And for them to become curious and interested requires that we become curious and interested. And to really begin a process of helping the client to very slowly begin to develop empathy or compassion for the parts. And we do that by helping the client understand that each part holds valuable information, that some parts are evidence of how the client survived, some parts hold feeling memories, and some parts are survival resources.